Chickenpox, also known as varicella, is a highly contagious disease caused by the initial infection with varicella zoster virus. The disease results in a characteristic skin rash that forms small, itchy blisters which eventually scab over. It usually starts on the chest, back, and face. It then spreads to the rest of the body.
Chickenpox is an airborne disease which spreads easily from one person to the next through the coughs and sneezes of an infected person. It may be spread from 1 to 2 days before the rash appears until all lesions have crusted over. It may also spread through contact with the blisters. Those with shingles may spread chickenpox to those who are not immune through contact with the blisters. The disease can usually be diagnosed based on presenting symptoms. However, in unusual cases, it may be confirmed by polymerase chain reaction, testing of the blister fluids or scabs. Testing for antibodies may be done to determine if a person is immune. People usually only get chickenpox once. Sign and symptoms. The early prodromal symptoms in adolescents and adults like me are nausea, loss of appetite, aching muscles, and headache. This is followed by the characteristic rash or oral sores, malaise, and a low-grade fever that signal the presence of the disease. Oral manifestation of the disease, not uncommonly, may precede the external rash. First, I have a small one, then it becomes like this with water inside. In children, the illness is not usually preceded by prodromal symptoms, and the first sign is the rash or the spots in the oral cavity. The rash begins as small red dots on the face, scalp, torso, upper arms, and legs, progressing over 10 to 12 hours to small bumps, blisters, and pustules, followed by umbilication of the formation of scabs. At the blister stage, intense itching is usually present. Blisters may also occur on the palms, soles, and genital area. Commonly visible evidence of the disease develops in the oral cavity and tonsil areas in the form of small ulcer which can be painful or itchy or both. I have in my oral cavity and tonsil areas. It's really painful. These symptoms of chickenpox appear 10 to 21 days after exposure to a contagious person. Adults may have more widespread rash and longer fever, and they are more likely to experience complications such as varicella pneumonia. I can still remember what I feel mag-agulo ka sa kasakit, labi na samad sa ilalom sa imong baba. Because watery nasal discharge containing live virus usually precedes both exanthem external rash and enanthem oral ulcers by 1 to 2 days, the infected person like me actually becomes contagious 1 to 2 days before recognition of the disease. Contagiousness persists until all vesicular lesions have become dry crust, which usually entails 4 or 5 days, by which time nasal shedding of live virus ceases. Chickenpox is rarely fatal, although it is generally more severe in adult men than in women or children. Prevention. Hygiene measures. The spread of chickenpox can be prevented by isolating affected individuals, Contagion is by exposure to respiratory droplets or direct contact with lesions within a period lasting from 3 days before the onset of the rash to 4 days after the onset of the rash. The chickenpox virus is susceptible to disinfectant. Notable chlorine, bleach, cutting the nails short or wearing gloves may prevent scratching and minimize the risk of secondary infection. Treatment: paracetamol may be used to reduce fever. I only use paracetamol at the time when I have a chickenpox. You can visit also to the doctor for antiviral drugs because they are the one who can prescribe it. But paracetamol, we can buy it in the store. For the itching, you can use the antihistamine. You can buy it in the store, in the pharmacy. As you can see, I have a dip here because I do scratching. I have a lot of scars so far, to be honest. Usual onset is 10 to 21 days after exposure. The duration is 5 to 10 days.